Hello, this is Dr. Gary Larsen here, and the reason why you're watching this video is either you have a tooth that's maybe bothering you, someone might tell you you need a root canal, or maybe you have a dead tooth already, or maybe you already have a dead root canal tooth. And the reason why you're watching this video is because I believe all my patients should be informed about root canals so they can decide what to do with them. In front of you is a picture, a drawing of a tooth, and if you look carefully at this drawing, this represents the blood supply, the inner part of the tooth where the pulp is, and then these little tubules, actually are called dental tubules, and out here in a healthy tooth you'll see beads of sweat form. The tooth definitely has a fluid transport. The fluid moves in a certain direction to keep things clean. And this picture here is a microscopic view from the inside of the tooth looking out, and as you can see, a tooth root has maybe 10% air. Okay, so, and then what they do is they rotor the middle of the tooth. So here we go. We're going to rotor the middle. We'll say there was a problem with the nerve. It's sensitive hot and cold, and this is what they do. They put a pink rubber in there, and then they can never seal this part, and the concern is this part becomes full of bacteria and other infection, and the concern is even greater because as you bite up and down, the concern is you're pumping these toxins and bacteria into your bloodstream. And there's even more concerns because the bugs living down in here are the anaerobic bugs, which are the bugs and the bacteria that grow in the lack of oxygen. These are the super duper nasty bacteria that no one really wants. So is a tooth that's been root canaled, or it's a dead tooth, is it really kind of like having crummy shower grout you can never clean? Let's have a look at this picture here. This patient here, she had a tooth here that's alive, has a metal-free crown, and this tooth has a metal-free crown. Now this live tooth, this is what a tooth normally looks like, but look at this tooth here. Why is it so dark? Why is there a zone of purple here? Well, the only thing that's really ever made any sense to me is when a tooth is dead, like this one is, and it's been root canaled, it starts allowing bacteria to grow inside of it. In fact, if you bite up and down, you pump this up and down, the concern is you're starting to put toxins in your lymph system, which eventually gets into your circulatory system. Look how this is all extra purple here. It's kind of like taking a toilet plunger up and down in your toilet with a bunch of poo, and it's pumping it up and down, and it's starting to go into your lymph system, which goes in your bloodstream. But maybe this is just a rare case. This patient here came to me, and this tooth here was barely alive, but we could not save it, and mom wanted it removed, and then we removed it, and then after I removed it, mom said, well, the tooth right above it has been root canaled. You're going to remove that tooth also, aren't you? I said, if that's what you want. So we proceeded to remove the tooth above. Look at the color difference. Look at how this tooth has a lighter white color, and look at this darker color, and look how it's really dark down here. I can guarantee you something. If you pull out a lower tooth in a person who the tooth is alive, then you pull out the upper tooth in the same person and their tooth is alive, the tooth roots are going to look the same color. The enamel might look different if someone was sick, but the teeth roots look the same color. But in this case, only difference is this tooth was alive and this tooth was dead, and I pulled them both out within 10 minutes of each other. Now here is Dr. Thomas Levy, board-certified cardiologist. Because of DNA research, he now says that probably 70% of heart attacks are caused by root canal teeth. He goes into showing how the atherosclerotic plaques they took them out of people with diseased hearts, and they sampled them for bacteria, and they found indeed there was bacteria. Then when they did DNA research into the bacteria, they proved the bacteria came from the mouth. And he goes into physiology as to exactly why he believes probably 7% of heart attacks are caused by root canal teeth. And then he also goes on to talk about how, and he quotes Dr. Boyd Haley, his research, how a root canal tooth is a chronic toxin factory, because Dr. Boyd Haley did research on 5,000 consecutively extracted root canal teeth, and he showed all root canal teeth were toxic, and they were inactivating critical enzyme systems that were necessary for life. Now, another interesting article here is one by Dr. Mercola, and if you go onto Google and type in 97% of terminal cancer patients previously had root canal procedure, like I kind of did here, then you can find Mercola's article and you can learn in depth the concerns about root canals. And you can click on that and play that. You'll hear him talking. He's a physician. He talks about how over 100 years ago they knew these things. And he then goes on to say it's the root cause of much disease. Root canals linked to heart, kidney, bone, and brain disease. And he talks about how those good bacteria become bad because in that anaerobic environment. He's quoting Dr. Price's work over 100 years ago. So anybody that has a root canal is thinking about a root canal probably should really look at that article. It's kind of disturbing what he says. So let's talk about your home, because I can't give health advice. The two doctors that I showed you there, they're medical doctors. They can give you health advice. Let's say you have toxic mold growing in your home. Well, what do? They bring in a hazmat team like you see here, and they remove it. Well, this patient had a dead tooth. It was infected. She didn't want it anymore, and she decided to get rid of it. Apparently her mercury fillings, she kind of hadn't got around to get rid of those mercury tooth splitters yet, but that's anyways her choice. So we took the tooth out and put in a metal-free implant, and then there we are 4 months later. And now we have another patient. This lady came to me because she had these two perfectly done root canals, but they didn't feel quite right, so the dentist kept adjusting them, and she finally did her own adjustment. She decided to adjust who her dentist was, and she came to me. And I kind of explained the concerns with root canals, and she'd been doing research into breast cancer, and she kept seeing root canal concerns popping up with that, and so she told me to remove them. So we removed them, put two metal-free implants in there, let them heal. This is about 6 months later. I don't know why she didn't come back 3 to 4 months later, but anyways. And then we put the crowns on, and here are her crowns on top of her metal-free implants. Now this patient here came to me, and she's having a lot of pain. This tooth hurts actually because the tooth's nerve has died inside of it, and it's abscessing. This has infection here, failed root canal. This root canal here is failed if you look there. This mass decay. So all these teeth are bad. She's in her 20s, so what do? You do more root canals that fail? Or what do you do? So anyways, she chose to get them taken out, get metal-free implants put in there. Here she is 4 months later. We put the metal-free crowns on. This is the second visit. Here, these are the metal-free crowns on her real teeth. So let's compare it to the implant work. These are the implants on the other side. So that's kind of what we always try to strive for here. Now, this implant is a special implant. It has at least probably 50 advantages over the typical implant. But one thing we have to be careful of is when we put this implant in, because it's one-piece implant, we don't want to bang on this implant. If we bang on this really hard, for at least within the first 3 months, the bone that's now trying to fuse the implant, it can get jostled, and then the gum tissue just grows around the whole implant and falls out, and then we don't want that to happen. So when it's a front tooth, though, we actually end up taking something like Invisalign. It's a clear aligner. We kind of line the front of it when it's a front cosmetic area, and we make it so it kind of looks pretty. But when she pops in, this is now protecting the implant. She cannot bite on the implant. If it's a back tooth, we just do the clear guard with some spacing so that it reminds one not to bite on the implant during the healing period. We need a minimum of really 3 months until the implant is fully healed. I usually like to wait a little more than that. This is an interesting chart here, which is called a dental meridian chart. It was designed by a German medical doctor, and I've seen some interesting things about this chart, and I will tell you this. Every patient that I have that has or has had bladder cancer, they all have a root canal in this area. I think that's quite significant. And I also have another lady who doesn't know root canals are bad. I keep telling her she should do some research into root canals, but she has not felt good ever since she had her root canal. And a year after she had her one and only root canal, they ended up removing part of her large intestine. But this chart's also wild, and I have seen some correlations with emotions and teeth, which I didn't really think was possible. But I do know of one female patient, when we removed the root canals, her depression in which she is receiving disability for totally went away, and she's been happy ever since she got her root canals out, and she actually had these emotions and those totally disappeared. So root canals might affect you in more ways than you know.